Do you find yourself feeling stressed out when you are studying for an important exam or when you are practicing repeatedly in front of a mirror before a presentation? It's perfectly normal to feel stressed out or anxious every now and then. Unfortunately, for some of us, our anxiety can get so out of hand that we feel this way constantly. That chronic feeling of anxiousness and fear is the marking of an anxiety disorder. GAD. GAD is Generalized Anxiety Disorder. The definition of Generalized Anxiety Disorder, which is GAD, is characterized by persistent and excessive worry about a number at different things. It is most common among anxiety disorders to be diagnosed. People with GAD suffer from intense and persistent worry. A GAD sufferer can worry or feel anxious about a number of events ranging from school or work to their family life at home.
Hey Ruby, how are you doing? Mind to share? What's on your mind?
I'm not sure. I thought something like, when my husband ran up the road to the grocery store, I worried a lot that a drunk driver would kill him. I wondered how I would live without him, losing myself in all the minute details of finding a job and all.
Oh my, that's not normal, Ruby. It's excessive. Look, we need to treat you for that. You may be suffering from anxiety. Trust me, I am a psychiatrist. That's about Ruby. Suffering from anxiety. There are 6 types of anxiety: phobia, generalized anxiety disorder or GAD, panic disorder, social anxiety disorder, obsessive compulsion disorder, and separation anxiety disorder. But for Ruby, she is suffering from GAD, generalized anxiety disorder. Some of you must be wondering, what is GAD? Well, GAD is characterized by persistent and excessive worry about a number of different things. Usually people with GAD may anticipate disaster and may be overly concerned about money, health, family, or any other issues. They usually find it difficult to control their worry, same as Ruby, too much worry about her husband. How will GAD be diagnosed? GAD is diagnosed when a person finds it difficult to control worry on more days than not for at least 6 months, and must has 3 or more symptoms. In United States, it affects 6.8 million adults or 3.1% of the US population, and women are twice as likely to be infected. Some people might ask me, "Hey Amanda, what are among the causes of GAD?" Well, based on the Anxiety and Depression Association of America, the exact cause is unknown. But there is evidence that biological factors, family background, and stress could be one of the causes. Let's talk about the physical symptoms that GAD patients may have. To anyone with GAD, they will have an increased heart rate, feeling weak or tired, shortness of breath, palpitations, and fatigue.
The physical symptoms of GAD, such as first, fatigue. Fatigue is becoming easily fatigued is another potential symptom of generalized anxiety disorder. This symptom can be surprising to some, as anxiety is commonly associated with hyperactivity or arousal. For some, fatigue can follow an anxiety attack, while for others, the fatigue can be chronic. Second, irritability. Irritability is a feeling of agitation, although some describe agitation as a more severe form of irritability. Regardless of the term you use, when you are irritable, you are likely to become frustrated or upset easily. You might experience it in response to stressful situations. Third, restlessness. Constant restlessness can be a sign of many different conditions. Many psychological conditions, including post-traumatic stress disorder, attention deficit hyperactivity disorder, depression, generalized anxiety disorder, and bipolar disorder, can result in frequent or constant restlessness. Lastly, difficulty sleeping. Difficulty sleeping is anxiety can cause serious sleep issues such as insomnia. While experiencing anxiety attacks may cause many people to feel exhausted or fatigued, the act of feeling asleep may actually become harder due to the anxiety and the body's sense of worry or fear.
GAD can be cured by psychotherapy and medication. There are a number of medication choices. They must also be treated with appropriate therapies. It also can take only the medication alone or in combination with the therapy. The most questions I get is what happens if GAD is left untreated. Most of the time, once the event that causes anxiety is resolved, the anxiety goes away. But sometimes, this extreme worry can eventually interfere the ability to carry out everyday activities such as driving. It also will worsen other physical health condition if it is left untreated. So, I am highly recommended to take proper treatment rather than to let yourself getting worse due to anxiety.
What is causes of generalized anxiety disorder? First, genetics. We know that genetics seems to play a role in the development of some anxiety disorders, and there is evidence that genes play a modest role in GAD, which is generalized anxiety disorder. Second, stress. Stress, recent or prolonged exposure to stressful situations, including personal or family illness. It's normal to feel anxious from time to time, especially if your life is stressful. However, excessive, ongoing anxiety and worry that are difficult to control and interfere with day-to-day activities may be a sign of generalized anxiety disorder. Lastly, excessive consumption of caffeine or tobacco, which can make existing anxiety worse. If the amount of caffeine is high enough, these effects are stronger, resulting in caffeine-induced anxiety. While there are mental benefits to caffeine, high doses are known to induce anxiety symptoms, and people with panic disorders and social anxiety disorder are especially sensitive.
In summary, GAD is one of the common types of anxiety disorder in older adults, especially women. It is characterized by excessive, uncontrollable worry about everyday things, including social situations. Before it is too late to be cured, it is best to realize that you can't control everything. Hence, avoid pressuring yourself to be perfect and replace the negative thought with positive one, or another way to cope with GAD. Although it is helpful, these tips are often not enough. Do not be afraid to seek professional help via psychiatrists, therapists, counselor, and among other mental health professionals.